A new study by an international team that represents the institutions of Sweden, Australia, and the United Kingdom is providing doctors with an overview of primary hyperparathyroidism management, including the prevalence of comorbidities and tendencies of clinical results, as well as the rate and the impact of the parathyroidectomy on the risk of adverse results. Directed by researchers from the University of Gothenburg, the results of the study provide information on the highest risk of adverse events associated with primary hyperthyroidism, including a 51% increase in the risk of hip fracture, a 45% increase in the risk of cardiovascular events, and 72% increase in the risk of mortality, compared to its counterparts without hyperparathyroidism, but also details the apparent reductions in the risk associated with the one subject to parathyroidectomy in this population of patients. We show that not treated primary hyperparathyroidism means a 51% higher hip fracture risk and a 45% increase in heart attack or the risk of stroke. The risk of renal stone is almost quadruplica, and, in addition, the risk of 72%. The greatest probability of these complications highlights the importance of identifying patients with this hormonal disease, said principal researcher Christian Axelsson, Master of Science, MD, PhD, a researcher at the University of Gothenburg, resident of general medicine within the public primary care in the Västra Götalandandia region, in a prayer. Citing a lack of well-controlled and large-scale trials, Axelsson and other researchers designed the current study with the intention of estimating primary hyperparathyroidism associations at risk of fractures and other comorbidities, as well as to assign whether the parathyroidectomy could influence associations between primary hyperthyroidism and adverse results. Using Swedish national records, the researchers identified all patients who were diagnosed with hyperparathyroidism in hospitals in Sweden from July 1, 2006 to December 31, 2017. Using the same records, the researchers identified 10 control people for each patient with primary sex-based hyperparathyroidism, year of birth, and residence county. In general, the study population included 16,374 patients with primary hyperparathyroidism and 163,740 coincident controls. The study cohort had an average age of 67.5 years, and 78.2% were women. Of the 16,374 patients with primary hyperparathyroidism, 42.3% underwent a median of 0.50 years after diagnosis. The total monitoring time was 42,310.